Welcome to the Clinical Education Initiative podcast, Conversations with CEI, where we feature conversations with clinical experts, their experience and insights on current health issues in the areas of HIV, primary care and prevention, sexual health, hepatitis C, and drug user health.
Welcome, and thanks for joining episode 39 of the Conversations with CEI podcast. My name is Lauren Walker, and I'm the Program Director for CEI's Hepatitis C and Drug User Health Center of Excellence. Today, we'll be talking about what it takes to integrate hepatitis C care in an opioid treatment program. Between 2010 and 2022, the latest year for which data are available, over 194,000 New Yorkers were diagnosed with hepatitis C. And of those, 53%, or just over 103,000 individuals, are known to have cleared their infection, either through treatment or spontaneously. This statistic is worth celebrating, but also highlights the ongoing need for action. The goal outlined in New York State's Hepatitis C Elimination Plan is to reach 80% by 2030. People who inject drugs are disproportionately affected by hepatitis C. In 2022, 48% of newly reported cases of acute hepatitis C in New York indicated injection drug use as a risk factor. And when analyzing cases with known risk factors, that figure rose to 81% of newly reported acute cases indicating injection drug use. If we let the data guide us, it's clear that additional efforts are needed to alleviate primary infection and reinfection among people who inject drugs. We'll talk about one such effort today: providing respectful and responsive hepatitis C treatment in opioid treatment programs, or OTPs for short. They're uniquely poised to engage people who inject drugs and integrate hepatitis C treatment to expand access to those who need it most. My guest Abigail Hunter will share her experience working as a clinical provider at a syringe service exchange program in Brooklyn and best practices for OTPs interested in adding hepatitis C treatment to their clinical offerings. And with that, it's my honor to introduce today's guest. Abigail Hunter is a family nurse practitioner focused on substance use, harm reduction, and hepatitis C treatment in outpatient community settings. In January 2020, she began working with the Respectful and Equitable Access to Comprehensive Health Care, or REACH program, at Mount Sinai, in collaboration with Vocal New York, a statewide grassroots organization that builds power among low-income people affected by HIV, homelessness, and incarceration through direct action, community organization, and service provision. At the Vocal New York Mount Sinai Cures Clinic, Abigail and her colleagues provide low-threshold, non-judgmental hepatitis C treatment, wound care, and buprenorphine. Previously, she worked at an opioid treatment facility providing methadone, buprenorphine, hepatitis C, and primary care to people who use drugs. Hi, Abby. Thanks for joining us. How's your day going today?
My day's going great. Thank you.
Wonderful. Before we really start with today's episode, I think it'll be helpful for our audience to hear a little bit about your personal background and experience and maybe help understand why we invited you to join today's Conversations with CEI.
Yes, thank you so much for inviting me. I am a family nurse practitioner with a background in public health. And my previous job before working with the REACH program at Mount Sinai was with an opioid treatment program where I provided hepatitis C treatment. So being asked to discuss this topic is very relevant for my past experience. And my current experience is I'm based at a low threshold agency where we provide care for substance users, drug user health care, including hepatitis C, wound care, urgent care, buprenorphine, and referral for primary care. I'm very passionate about providing care for people where they're at, and many people who need hepatitis C treatment are engaged in healthcare. It's basically upon us to be able to go where the people are. And I'm happy to be at places where substance users are going and where I've been able to provide treatment.
Amazing. And thanks again for joining us. So we heard a little bit in the intro about the hepatitis C epidemic, particularly among people who use drugs. And I feel like before we get started, I do want to point out that people who use drugs and substance use disorder treatment programs were identified in the 2021 New York State Hepatitis C Elimination Plan as priority populations and settings to focus hepatitis C elimination efforts. So, Abby, can you tell us why it's important to provide Hep C treatment to people who use and inject drugs, and more specifically at opioid treatment programs themselves?
So there's a lot of belief that people with substance use, active substance use in the past were not good candidates for hepatitis C treatment. And so were often not offered it. It was believed that they wouldn't be adherent, or there's in some cases people have told me that they were told by medical professionals that their Hep C wasn't very active and that they could wait to get treatment. So there was definitely misinformation and stigma in the past, and that has changed, fortunately. And opioid treatment programs are the perfect place to treat people because they are coming to these programs very frequently and they are very engaged in care. It's a very good place to provide treatment because there are lots of people that can help with getting the medication, with adherence, with managing side effects, with conducting blood work, and basically just being support for the person. A lot of people want to get their Hep C treated, but they have felt like providers, traditional providers, don't want to treat them. And often people who are using substances don't get very good treatment at traditional healthcare settings. So an OTP where there's less stigma because they are there for their substance use is the perfect place because they feel comfortable. They have counselors and other staff that they already have attachments to. And adding the service such as Hep C kind of decreases the silo of just substance use and focuses on potentially other health issues, other healthcare issues that people are interested in getting taken care of. So it is absolutely the perfect place.
I've heard people call it holistic treatment or whole person treatment. And that's really what my brain keeps coming back to, especially as you were talking about that. It's not just one thing, it's everything. And really treating all of that in one place, it just makes sense. So, in a perfect world, here we are. Imagine that all of the OTPs in New York provide Hep C treatment to their participants. What type of impact do you think that would have on improving the health of New Yorkers and overall achieving those hepatitis C elimination plan goals to remove Hep C as a public health problem in the state by 2030?
So, when we look at statistics about the transmission of Hep C amongst active users, we see that one person can potentially infect 20 other people, I believe, in the first 1 to 2 years of using. Again, historically, it was seen that you don't want to treat active users. But if you put your public health hat on, you see that, in fact, treating people who are actively using are exactly the people you want to treat because they're the folks that could potentially transmit Hep C. So, very important to look at this kind of from a meta view, a public health view. And if you're looking at elimination, you want to decrease the risk of transmission amongst people that are actively using. So they're engaged potentially, hopefully, with a syringe exchange program. So they are using new equipment, and they are also now not transmitting Hep C or HIV or any other potential infectious diseases to move us further along in the Hep C elimination plan.
I'm curious, what would you say to potential naysayers who are listening to our conversation now thinking about reinfection? I'm not going to treat that person because they're injecting drugs and they might get reinfected. What would you say to that clinician?
So that is something that's very common. And again, I always try to make parallels to other health areas. such as sexually transmitted infections. We could never imagine saying to someone, okay, I'm going to treat you for syphilis or gonorrhea, but if you come back with it again, I'm not going to treat you. If you look at diabetes, same thing. If you have to increase someone's insulin or other medication because they're not adhering to the guidelines with diet, we could never imagine saying, okay, well, no more insulin for you. I'm sorry, because you're still eating at McDonald's or not exercising the way I asked you to. So I feel like a lot of it is the stigma that's associated with substance use, even though most of us every day use some sort of substance or another. So I do think it's stigma. And I think if we examine ourselves, look in the mirror, all of us, we can see that we've incorporated some of our society's stigma around substance use and substance users.
Okay. Back to the real world. We are no longer providing Hep C treatment in every single OTP in New York. What are some innovative strategies and best practices that you've implemented or seen implemented elsewhere that can facilitate HCV treatment in an OTP setting?
So I'm very fortunate to be part of the REACH program, which has a grant from the CDC funneled through the New York City Department of Health that provides treatment for people that are in short term detox and rehab programs. So we partner with programs and we provide Hep C treatment via telemedicine to these programs. And then once they leave these programs, we follow them either back to their shelter, to a long term program, back to their apartment, and we provide treatment. So that's an innovative model. The other thing we do is we partner with OTPs in our own Mount Sinai system. So we work with the staff at the OTPs, and our community health workers go out to them and will set up telemedicine visits. They will be with the participant at the OTP, and I will be on the other end of the phone doing the telemedicine visit. And we will provide hepatitis C treatment to people that are going to this OTP but have not had their Hep C treated. And they know they have Hep C because OASIS guidelines require that anyone that's in an OTP program get a yearly physical. Every year they get blood work, and in the past, every year they've been found to have Hep C, and they haven't gotten it treated for a variety of reasons. So those are the kind of innovative models to be able to get the staff and the providers connected to people that have Hep C that are engaging in care.
I'm really intrigued about the role of telemedicine, and I could see it being very successful and useful in providing services, to people who use drugs. Could you talk us through a little bit more about how that works and why it is so successful for you?
Medicine is something that I participated in before the pandemic. When I was back at an OTP, we had a connection with a provider offsite, a hepatologist, and that person guided me. I was sitting with the participant at the OTP, and that person was helping me when I was first learning how to do Hep C treatment. So that was very useful. But it got to the point where, since I was on site at the OTP, I did not even need the help of the hepatologist anymore. But initially, during training, it was extremely useful to have the offsite provider helping the on-site provider. So that's one very good use. Another good use through the Innovative Models program from the New York State Department of Health that I've been able to be part of is we would actually treat people who were off-site on the street. They were getting supplies from the peer delivered syringe exchange program, And another staff member, a community health worker, would be with the person on outreach, and I would do telemedicine with that community health worker, with the person who was picking up supplies in the street in 10 different neighborhoods in Brooklyn. And so there were some people that I treated for Hep C who actually never stepped foot in a building. The community health worker was able at that time to escort the person to a LabCorp for blood work. And then they were able to bring the medication to outreach. And we were able to do everything virtually. That was during a period where we didn't have a hub building for Vocal New York. Now we have a building, so we don't do that as often. But during the pandemic and when we didn't have a location, that was another really nice way to use telemedicine. And I think I mentioned already the rehabs and the OTPs through the CDC grant. Those are other very good ways to use telemedicine.
Wow. Let me just say, on behalf of our listeners, congratulations. Another example of providing services to people exactly where they are and when they need them. Thank you. I feel like we're wrapping things up here, and I'd like to ask a question I typically ask all of my guests. As a final take home for the audience, in your opinion, what are the top 3 things an OTP needs to implement HCV treatment?
So I think I referred to it earlier, but medical care can be very siloed or very separate, or just like body systems are treated very separately. So I think OTPs can take ownership of the hepatitis C issue, that it's something that comes along with people who use substances. And so that's one thing. And I think that the OTPs will actually really enjoy interacting with people and providing this additional service. So it's very satisfying to provide this treatment. I can't tell you the number of times when I've told people, look, your liver is fine, you are okay. And they cannot believe after all these years of using substances that their liver is still okay, and the relief and just how happy they are that it's an easy treatment, the treatment's available, their insurance will cover it. That not only is it available, the medication is amazing. It's a slam dunk in terms of cure rates. So super amazingly satisfying work. And I think that P's being part of this, it's very enjoyable. Also, a lot of the people will tell me that having a success, feeling like they can cross something off their list, that they can finish something, that they can get rid of Hep C. A lot of people didn't even realize or don't realize that they might not be feeling well due to the Hep C, and they feel better once they get treatment. I think the OTPs can expand their good care by including hepatitis C treatment and being able to provide a wider service to the people that are already coming to their programs. And it's so satisfying. And so many times people have told me all kinds of nice things. And hearing that and being able to be part of that with something that's really quite easy to do has probably been the most satisfying part of my career.
Satisfying and gratifying. Listeners, please take that home with you. And if you need an extra hand in getting started with this, you can always reach out to us at CEI. Visit us online at www.ceitraining.org, and we would be happy to help. Abby, thank you so much again for joining us. Anything else you'd like to share with the audience today?
Just don't be afraid of learning a new skill. CEI is here to help you. I, as a nurse practitioner, did not know how to do hepatitis C treatment. I'm not a hepatologist, but I had a little bit of guidance. I had some help. And now it's so pleasurable and it is not complicated. So reach out, expand your bag of tricks, providers, and get some help from CEI and be able to do something that's super satisfying. Thank you.
Conventional methods of hepatitis C treatment delivery, including referral to an offsite location or specialist, have discouraged many individuals from accessing, initiating, and completing treatment, especially people who use and inject drugs. Opioid treatment programs play an integral role in supporting people who use drugs, and after talking with Abby, it's clear to me that they can successfully provide hepatitis C treatment to improve patient health while also reducing barriers and benefiting society in general through reduced transmission. If we really aim to eliminate hepatitis C in New York State by 2030, we need to prioritize integrating hepatitis C care into OTPs and providing dignified healthcare services, including hepatitis C treatment, to people who use and inject drugs.
Thank you for tuning in. Join us next time for a new episode of Conversations with CEI. Visit us at ceitraining.org and follow us on CEI social media platforms.